I remember writing something where it was as a commentary on a news article. There was a drug that got recalled, and then I think a patient a few days later brought that article up in the exam room and say, "Oh, I read your blog online," and that's when I realized that we do have a voice that extends outside of the exam room. And at first, it was just correcting misinformation and commentary on what the studies that were coming out and questions that patients had from what they're reading in the newspaper, things like advocacy and fighting back about some of the misinformation. And now we talk about the political climate that we're in, and that importance of that voice has only grown since.
This holiday season, here's a book worth giving. Microskills, Small Actions, Big Impact. Big change starts smaller than you think. This book reveals what science already knows. Transformation happens through small, actionable behaviors and steps, not grand gestures. Building blocks that compound over time. For the high schooler mapping their future, the professional ready to level up, and the leader who knows there's always more to learn. In audiobook, ebook, and print. Available at Amazon and all booksellers online. Give the book that gives people back their agency. Microskills, Small Actions, Big Impact. This is the Visible Voices podcast. I'm your host, Dr. Resa E. Lewis. And today I'm speaking with podcaster, keynote speaker, and social media healthcare visible voice, Dr. Kevin Poe. Kevin is a practicing board-certified internal medicine, practicing primary care in New Hampshire. He built KevinMD from scratch in 2004. What started as a single platform now receives over 3 million monthly page views. Kevin, it is amazing to have you. And as you noted before we pressed record, we've kind of flipped the mic. We flipped the script. I've been generously hosted on your podcast, and you generously said yes to joining me. These members may not be familiar with you or with your platform. So give us the 411 on KevinMD.
Well, again, thanks for having me on. And you gave a brief introduction of what I do. I'm an internal medicine physician first, and I've been practicing for 23 years now. I trained at Boston Medical Center, and after that, I landed my first job out of residency in Nashua, New Hampshire. And contrary to the statistics, I've stayed at that first job after residency ever since. So I do primary care for the past 23 years in the Nashua community. And as you mentioned, I also founded KevinMD since 2004 as a place where clinicians and those across the healthcare spectrum can share their stories. And it's certainly grown into a platform, and it's provided dynamic commentary as our health system is changing every day. And we've been through some interesting times, interesting phases over the last 23 years, and we continue to do so today.
Yeah, and we're going to deep dive into the platform, but tell us a little bit about your clinical practice. I realize it's not the majority of your time, but it certainly is a presence in your regular doctoring life.
Yep. So I think we talked about earlier, I do practice half-time, 0.5 FTE. And, I was just at clinic yesterday, and there's just a lot of patients that I see. They've been with me since the very beginning. I was there before I was 30, and some of these patients are with me 20 plus years later. And people say that's a cliche, that the patients grow along with you. But if you've been at a practice that long and you see the patients for 20 plus years and they're still with you, and we can still reminisce the times where I just started fresh out of residency, that to me is very gratifying. It gets to the core of why I continue to do primary care.
Yeah, I'm interested. We don't know a lot of people that are, I'll say, contently or happily practicing primary care because of the U.S. healthcare system. What is one of the most joyful aspects of your practice, and what is the most challenging that probably is different in 2025 than when you first started out 23 years ago?
I think without question, the most joyful aspect are the patients, right? And a lot of my patients, they're just really happy to see me. They wait months to see me, and they're very happy to see a primary care physician because, as you know, it's very difficult to find a primary care doctors these days. And the gratitude that patients have when they come into my visit, to me, makes me feel that I'm making a difference. And I know that a lot of people say they want to go into medicine to make a difference, but in primary care, I truly feel like I do individually in the exam room. In terms of what makes primary care difficult, people, I'm sure, listen to your show, to listen to my show, they read KevinMD. So many obstacles that prevent us from giving the best care that we possibly could to patients. You have all the bureaucracy, the regulations, the pre-authorizations, all the health IT issues. I think there's a lot of roadblocks and obstacles that really prevent us from getting to the core of what primary care should be, and that should be the doctor and patient in the exam room.
Yeah. Do you think your practice is unique, or do you think it's the exception? People going into med school, studies show that a lot of people are not choosing and don't plan to choose primary care.
I don't think my practice is unique. I practice in a hospital owned clinic. There are about 5 to 7 of us. And like any practice, we have a lot of the same issues and complaints that clinicians have in primary care. But what I do think is unique is what I do outside of the exam room. And I'm sure that we're going to talk about. I have a lot of things that I do outside of primary care. I have a platform, KevinMD.com. I have a podcast where I talk to doctors across the country. And one of the themes that I have on my site is that physicians are more than our degrees, right? And I think what is unique is having that setup where on one hand, I can see patients and do primary care, but on the other hand, I have other avenues that really fill my proverbial cup and makes the entire practice of medicine all that more rewarding and sustainable.
You were the one that noted that you and I actually have Venn diagram overlap and, similar sort of motivations with our podcast, with the visible voice part. One story that came to mind based on what you just shared, because truly, like, it is a delight to see you smile and hear how much you like your clinical practice, because that's not the story of a lot of clinicians these days. I was sharing a story recently of I had a patient. This is on the South Shore of Massachusetts, and the patient was sort of didn't feel well, didn't want to be there, was basically the profile and the age of someone who could be my father. And it took a bit for me to win him over in terms of my competency, in terms of my patient care. By the end, he felt much better. He had a diagnosis. And what he said to me was, "Can I follow up with you as my primary care doctor?"
Mhm.
And I share that story because that is the biggest compliment that you can ever give an emergency physician as a patient, that they were so pleased with the care. And so I share that because I understand that feeling of gratitude. Your patients look forward to seeing you. And I just love hearing that. And I love that you shared that, because people know Kevin MD because of the platform, but they don't know always this piece of you. So thanks for that share. So let's get to the platform. I want to start with the podcast. You're a volume guy, meaning if someone has recorded with you, it's very organized and it's basically a quick cadence. Can you talk to us, that people maybe who haven't listened yet, who haven't recorded with you, about your cadence and why do you choose that process?
So the podcast by Kevin MD is a supplement to KevinMD.com, and I think I've been doing that for almost 20 plus years now. And people would publish on my site articles, and they'll share their stories and really give a lived experience in terms of what it would be like in their segment of the healthcare system. I've always wanted to start a podcast because I thought it would be a wonderful way not to just read their stories on kevinmd.com, but it'll be much more resonant if they shared their stories in their own words. People can see them share their stories and they can articulate some expression that goes beyond the written word, right? So I didn't get a chance to until the pandemic. And I think we've been talking offline that you started your podcast around that time as well. My primary care practice, I was partially furloughed. So I had a lot of time at home, like a lot of people. And I thought, hey, this was a wonderful time to start that initiative, start that podcast. And honestly, I didn't really know where to start, right? You have a lot of guides, but you don't really learn how to do something until you do it yourself. So I thought about some of the more successful podcasts during that time. I listened to the New York Times The Daily, which is, of course, a daily podcast about 15 to 20 minutes about the topics of the day, all the way to Joe Rogan, where he interviews someone for 3+ hours. I thought about what kind of style fits me the best. And one of the things that I am always strong at is workflow and procedures, right? I'm not the best conversationalist. I'm not the person that you can talk to and talk to like Joe Rogan in 3+ hours. So I did want to model my podcast around my personality and around my strengths. And that would be the New York Times The Daily, which is that 15 to 20 minute daily podcast. And I remember I started to call out to all the people who've written on KevinMD that I'm starting a podcast, and I didn't really know what to expect. But then for the first 2 months, it was booked solid every single day for 2 months. And then that's when I realized, boy, I really, really committed now. I can't really back out of this. So I remember the first few, they were pretty rough. If you go back and listen to my first few, I didn't quite know what to expect. But over almost 2,000 plus episodes, I've refined the workflow. I think in order to do something volume based and do something every day for almost 2,000 plus days and really without a staff, you have to have somewhat of a disciplined workflow. So that's why a lot of my podcasts, they have a similar structure. A lot of them have similar questions, but I try to stay out of the way because, to be honest, my guests are generally more interesting than I am. So I try to let my guests really take the stage and share their stories, and I just step back out of the way. So that's really how my workflow got refined over the years.
Yeah, there's many nuances here of visible voice. You've just shared how you made your own voice visible. You allow the voices of your guests visible, and you're on the visible voices. So I love the share and I love the background because, people will often sometimes ask me about my process. How did I decide? And it makes a lot of sense, that share regarding the daily. And yeah, I've had the pleasure, as I said, of being on your podcast, and I have experienced that getting out of the way. But what I think is particularly smart about your process is it kind of doubles down on your own knowledge, because not only are you supporting and reviewing the article that's on the website, you're also refamiliarizing yourself with the information. And so it's a good education tool for you.
Absolutely. I'm the luckiest person in the world because I can pretty much speak to any expert across the country. I have 20 minutes of their time and I can ask them anything I want. So I've learned so much. I've had physicians for organized medicine, professors who are certainly very busy and they carve out 15 to 20 minutes of their day with me. I learned so much with them. And it's not just inside of medicine. It's like I interview a lot of specialists, and as a primary care physician, I like to get their perspective on various diseases and whatever their specialty is and things I learned and haven't encountered since medical school. So from a clinical medicine standpoint, it helps me refresh my knowledge. So when I go into the exam room and I'm with a patient and they come up with particular symptoms, I can think back to when I interviewed that specialist and know what to ask. But also things that's tangentially related to medicine as well. So things outside of the exam room, like physician finance and the intersection between things like cryptocurrency and medicine, and things that a lot of doctors don't think about, but are, again, tangentially related to clinical medicine. And I've learned so many things outside of the exam room as well. So just having that interview and talking to experts from across the spectrum of healthcare, it's made me, I think, a more complete physician.
Your smiles and your joy, sort of, I see a reflection of my own feeling regarding speaking to guests on the podcast. And I'm not surprised. And I'm glad you shared about the vulnerability. And what I like is you don't shy away from topics that historically, traditionally in medicine, may not have been written about, certainly weren't talked about, and they were surrounded by shame, by stigma. So tell us about the platform, what you publish. And I've submitted before and I've gotten acceptances lickety split, like same day. So what is your process that allows you to process so much written content to get up on your website?
So I'm a one person show. Contrary to what a lot of people think, I do not have a staff of editors that go through what's submitted or proofread. I do have a technical team. So if the site goes down or if something happens to the site, I do have a technical team who could help me out. People normally would share an article on my site, just simple email. There's a form on my site. It'll come to me, and I probably would read it within 24 to 36 hours. I would receive anywhere between 10 to 40 articles per day. A lot of them would be easy that to decline. There is a lot of, as you know, with any public platform, you're going to get a lot of pitches from PR companies, a lot of sales. So those are easy to sift through. But I do get a substantial portion of people who have published before, like yourself, and a lot of people who have heard about my site and heard about someone who had a good experience publishing on my sites. A lot of students, people who are comfortable being vulnerable and sharing on a digital platform. So what I would do is, of course, read it, and more often than not, if it's an authentic voice, if it's an article that someone wants to share from any part of the healthcare spectrum, and as long as it's a reasonable take, I would publish it on my site. I do have a way of, I have various tools that I use to edit the site, for proofreading, grammar, and style. And then I generally would schedule it. I'm at a point where I'm scheduling about 5 to 6 weeks out, because if I just published whatever came in at the time without some type of scheduled system, I think the audience would be just overwhelmed by 20 articles at once. So I try to keep it between 4 to 6 articles per day, and then I have the daily podcast that's published at 7 p.m. at night. I think that this has been a good rhythm and cadence for me.
You answered some of the questions I had about how do you fact check, grammar check, plagiarism check, any AI check.
So I do use AI tools to have for grammar and style. So I do have a pretty comprehensive prompt that I refined over the last few months, and it's primarily for style, to make sure it's a consistent style, and then of course adhering to MLA style grammar checks and things like that. I don't have the resources to fact check, and I don't have the resources for that. But certainly, if they have links, I'll click through it. If it's a reasonable take, I certainly would realize that. And like I said, it's not 100%, right? So if someone did plagiarize something, that's probably something I may not have caught. If it's something that's obvious, I would. One of the things that I do try to pay particular attention to is that I do want voices, like I said, across the healthcare spectrum, but also across the political spectrum as well. And that's something that I have adhered to since the beginning, because when it comes to all the problems in our healthcare system, I do believe that we can have solutions from across the political spectrum, from conservatives to progressives. So I try to balance the opinions I take. So if I include a progressive viewpoint on a particular topic, I would make a concerted effort to also include one from the conservative point of view as well. So I do think that it's important to have a spectrum of political viewpoints, because that's a reflection of our society today when it comes to healthcare. We live in a polarized society, as you know, where half the country sees things through one lens and the other through another. And I think that should be reflective on my site as well.
Yeah. Do you actively, intentionally try to create inclusivity to have all those visible voices, or to have opinions, or people not historically represented in, writing or even on the podcast? Is there any intentionality done behind that?
So I don't solicit articles. So I think that whenever there's a major healthcare event that is happening, I get articles unsolicited from across the political spectrum. I think that they come from a very diverse viewpoint, because I know that KevinMD.com has that reputation of publishing things from various viewpoints. So that's not something I actively solicit, but articles come organically from across the political spectrum. So I'm lucky to have that diversity of viewpoints just come organically.
Yeah. Yeah. I'm wondering, back to the AI, like if someone submitted an article to you, like that smelled like AI
Mhm.
or was AI, do you have any, rules or regulations yet, or do you think you're moving that way?
I think that I've read enough articles that I have a pretty good sense of what AI looks like. Now, that being said, there are no real tools that can 100% sniff out AI. I think AI is always going to be one step ahead of AI checkers. I think that with the amount of reading that I do, I have a pretty good sense, and there are some tip offs in terms of what sounds AI or not. Is it 100%? Of course not. I'm sure that there are some articles that slip through and get published on my site that was completely written by AI. But I think that the majority of stories and voices on my site, I would hope, are authentic. And I think in general, I think most of them are. I do think it's difficult for an independent physician to come up with a platform these days. There are a lot of obstacles. There's also a lot of noise out there, and it's hard to break through that noise. So having that consistency over the last few decades has given me a little bit of advantage in terms of visibility. Also, in terms of importance, I do think that it's important to have an independent voice out there. I think healthcare in general has been very politicized, as we all know. Because of that, it's harder for physicians to have that voice, and I think that voice from that independent physician is more needed than ever with everything that's going on politically in healthcare. It's important to have our voices to be to be heard, because if physicians' voices aren't heard, then not only the way we practice medicine is going to be negatively affected, but of course, how we care for patients is going to be affected as well. So I think, especially now more than ever, it's important for our voices to be on a
See,
platform and be
say
heard.
more about this. This really hit me hard during COVID. And as you shared, we both started our podcast during that period. But, as physicians, we have a lot of privilege. And yet, I think there was a socialization, a training that we shouldn't put ourselves on these public platforms. We shouldn't take a stand. We shouldn't be political. However, healthcare and medicine and patient care has become politicized. So I too feel that we have a responsibility to advocate and to speak up, specifically when it comes to misinformation. So for listeners that are, sort of hedging, wondering, should I put myself out there? Like, what is your argument for why, yes, physicians, you should advocate and speak up and use your voice?
Yeah, and I've been saying this even before the pandemic as well. So I think three main reasons, and you bring up the biggest one, is misinformation. Because patients, of course, are going online, and that's even antiquated now. They're going on AI, right, to looking for health information. And if we're not there where patients are looking for online, then we're going to lose our influence on patients, because if they don't get information from physicians, they're going to get it from pseudo clinicians and people who want to sell something, people who have a political agenda, and they're going to bring that in the exam room. Already, I'm finding it more difficult to talk to patients about vaccines given the political climate. And it's taking up more of my time to convince patients that, hey, it's a good idea to get the flu shot. It's the fall. And just already, given the political climate, I'm already seeing a lot more resistance to that idea compared to previous years. So that's the number one reason why I think physicians need to be online, is really to combat that misinformation and create that counter narrative of evidence-backed scientific information that patients can trust. Of course, the second reason, and you mentioned, is advocacy. Because if physicians aren't online and sharing our voices, people who aren't in the exam room and experience what we experience, they're going to make the decisions for us. So I think it's important for physicians to advocate and speak out, because um, if we don't share our issues and express how important it is to solve it, then of course patient care is going to suffer as well. And I've always said the third reason is things like online reputation. I wrote a book on online reputation. I think that's another reason why physicians need to be online, because patients Google physicians online. And if we don't take control of our own narrative, other people, again, is going to talk about us and share and define us online. So we have to do it ourselves.
I'm so glad you brought up about this online reputation. Just like we can rate restaurants or people will look at restaurant reviews, people look at physician reviews. And I've had the experience of recommending someone, a colleague in a specialty, and the person to whom I'm recommending, that physician said, "Oh, but I looked at their online reviews." So say more about your book and what drove it and how we can sort of control that narrative, or can we control that narrative?
Yeah, so I think the book was written a long time ago when it comes to the digital age. I think back in the early, but I think that the core philosophy stays the same: is that we do need to define our own narrative online, because someone else would do it for us. I talked to a lot of physicians who say, "Oh, I don't want to be online. I don't want to, I don't care about." Online reputation. But the thing is, you already have a presence online, right? You have these third party sites that already give us ratings online, and that's how patients look for a lot of us. So I do think, exactly like you said, the first thing when what patients do is they do Google us online. And I think the biggest way that we can um, define our online reputation is to create that content online about ourselves. So it could be things like social media, it could be like the podcast that we're doing today, and really create the information online that we control and that we create. And that way we can define ourselves and not a third party.
When did you realize you had a voice and when did you start using that voice?
I think I realized I had that voice back when I first started KevinMD back in the early 2000s. And um, at that time, blogging was relatively new, and especially in that intersection between blogging and healthcare, there are very few physicians who had blogs. And I remember writing something where it was as a commentary on a news article. There was a drug that got recalled, and then I think a patient a few days later brought that article up in the exam room and say, "Oh, I read your blog online," and that's when I realized that we do have a voice that extends outside of the exam room. And at first, it was just correcting misinformation and commentary on what the studies that were coming out and questions that patients had from what they're reading in the newspaper. But that of course has grown, as we talked about before, into things like advocacy and fighting back about some of the misinformation. And now we talk about the voice in the current the political climate that we're in, and that importance of that voice has only grown since.
Yeah. So good. KevinMD, for audience members that want to follow along, perhaps submit something and tune into your podcast, what's the best way to find you and follow you?
Yeah, so of course, KevinMD.com is the best way. And there's instructions there in terms of how to share your stories. And I'm always interested in hearing stories, because especially from people who aren't seasoned writers. I think that's one thing I do want to emphasize. A lot of people who write for my site, it's the first time they've shared something in public. It's the first time they're writing. These aren't professional physician writers that publish on the New York Times op-ed pages. I'm not going for that, because those people already have platforms. But I want to speak to those who may not have written before and may not have those connections with mainstream media, people who may not be polished writers, but just because they're not polished writers doesn't mean that their story's any less important. Right. So that's one of the things that I do want to emphasize, is that a lot of times people write for the very first time on KevinMD, they get published, they get the feedback. And I'm gratified to say a lot of them have refined their writing and gone on to other opportunities in mainstream media. And the same goes for the podcast. And again, you can find that on kevinmd.com/podcast. It's the first time a lot of them have been on any type of media, being on a podcast for the first time.
Thank you so much for joining me today on the Visible Voices podcast.
Well, thank you so much for having me.
The Visible Voices podcast amplifies voices in the healthcare, equity, and current trend spaces. Our team includes Dr. Giuliano Deportu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis MD on social media, or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by our hosts and guests are their own and do not reflect the opinions of their institutions. Information shared here should never substitute for clinical judgment or for medical advice. Together, we're making healthcare more equitable, one visible voice at a time.